Hi, my name is Christopher Cox, and this week I have a three-part video on mechanical ventilation, weaning, and BiPAP administration. First, I'm going to talk about mechanical ventilation. I have my patient here, Miss Stevens. She's a 70-year-old retired bartender. Now, Miss Stevens has COPD. What's interesting in her case is that she has never smoked a pack of cigarettes a day in her life. Now, we attribute this to her work environment. She was admitted to the hospital, and now we have our scenario at hand. Her typical ABG is one where her pH is 7.35, her P(a)CO2 is 55, her P(a)O2 is 65, and her bicarb is 32. Now, in admission to the hospital, we found that her pH was 7.20, her P(a)CO2 was 100, her P(a)O2 was 50, and her bicarb is 35. Now, we're trying to wean her, but there are some special precautions that we have to take. Now, due to respiratory muscle fatigue, she is likely to fail every spontaneous breathing trial that we give her. Now, to help with that, we can give her pressure support to help decrease her work or breathing. Now, also, because she has COPD, we want to be careful about the amounts of FiO2 that we use, because we don't want to knock out that hypoxic drive. Now, she's currently in SIMV volume control. Now, she's on a frequency of 10. Her tidal volume is set at 450 milliliters. She's on 5 of pressure support, 5 of PEEP, and 35% O2. Now, our physician, Dr. Smith, wants us to titrate her SIMV rate to 4, which is fine, but I'm not just going to titrate that to 4 automatically. I'm going to titrate it down in rates of 2 and reassess every 30 minutes to an hour. So I'm going to do that now. I'm going to drop her down to 8, and I'm going to reassess her. Now, also, I'm going to look at her pressure support and change some other parameters here. So I'm going to increase her pressure support by 2 now that she's doing more work. I'm going to decrease her FiO2 down to 30, and her PEEP I'm going to leave at 5 because it's optimal for weaning. Now, it's been 30 minutes to an hour. She's doing fine, so I'm going to titrate her rate by another 2, and we're at 6. I'm going to see what happens. Now, for the sake of time, we're just going to say 30 minutes to an hour has passed. I've reassessed her. She's doing fine. So I'm going to finally titrate her down to the SIMV rate of 4. She looks good. We are ready to start weaning her. That's what we're going to talk about in our next video. Thanks for watching. And here are my sources. Have a good day.